Good day, good morning. My name is Nasogastric, and I will be demonstrating nasogastric tube insertion. So before we do all the procedure first, we are going to check for history of nasal surgery, and also we are going to assess the mental status of the patient. So after checking the history and assessing the mental status of the patient, we will proceed for the identification of the patient. So let's assume that my patient is a woman. So I will ask her to state her name and date of birth. So ma'am, ano po ang pangalan niyo ma'am? Buda kasawarin po kamo inaki. Okay, so I was able to verify her identity. Then now I will determine the type of size of tube to be inserted. And also after that, I will gather all the equipment that we need. And then I will now perform hand hygiene. I'm going to wash my hands and then put on clean gloves and then provide privacy for the patient. So let's assume that we have a curtain here. So we are going to pull the curtain around the bed, and also we are going to close the door to the room. And then after that, I am going to ask the patient to hyperextend her head to examine and observe the intactness of her nasal, and also to select which has the greater airflow. So I'm going to ask her to hyperextend her head and observe her nasal. Okay. Then after that, I am going to explain the procedure and its purpose. So, Ma'am Rodriguez, ma-insert po ako ng tube. Uyan niyo po, since ini po ang ining side na ini ang igwa ning ang maayos-ayos ning paghangos niyo. So, ma-insert ako ng tube sa inyo since di ka mo nakakaon, nakatuyon. Hindi po ang makatuwang sa inyo para makakaon ka mo. So then after explaining that, we will now get this tube and then we will measure this. So let's assume that this connector is a NGT tube. So from the tip of her nose to her earlobe, down to the xiphoid process, below is our stomach or sternum. Okay, so then I am going to mark this end with a micropore. And then I will set this aside. And now I am going to wipe the patient's face with a clean towel. So I'm going to gently wipe her face. And her nostril, also her nostril. And after that, you're going to lubricate this tube. So let's assume that we already lubricated this. Okay, now for the insertion, I will ask the patient to flex her head. Pa-flex po nimpayo. And then I will tilt her nose upward. Tilt her nose upward. And since I observed that this side here, this side has the greater airflow, I will now pass the tube. Gently pass the tube. So once the tube has reached the pharynx, I will ask the patient to swallow. So pwede po ma'am magtuyon-tuyon ka po ma'am. Okay, so the patient is able to swallow while I'm advancing my tube, and then I will slowly lower her head. Okay. I am advancing this tube as far as the insertion point. Okay. Now, I'm going to check the back of her throat. So, ma'am, pwede po mag-time ka po ning A. A. Okay, so, it is clear and the tube is not curled at the back of her throat. So, I am going to aspirate some stomach contents to check the placement of this tube. I am going to aspirate some stomach content. And then, after that, I will use this stethoscope and inject a 20 to 30 ml of air and listen for a whooshing sound. I will place this over her epigastrium, and then let's assume that this is a 20 to 30 ml of air. So I will now inject. While listening for a whooshing sound. Okay, so everything is clear. The tube is intact. Well, now I will secure this tube by taping it with a leukoplast tape. So let's assume that this is a leukoplast tape, since I only have a micropore tape. I will now secure this tube. Okay, and another. Okay. And after that, I will attach this tube to a suction source or feeding apparatus. So let's assume that this is a feeding apparatus. So I will attach this. Okay. Then I will secure this tube to the client's gown. Okay, then after that, I will remove my gloves and the gown that we used, and then perform hand hygiene. Okay, now, so we are going to clean this nostril and this tube. I'm sorry for that. Yes, I am going to clean this nostril, this tube, and document today's date and the time of insertion. That is